from the floor to the bed or the bed to the floor can be a transfer. So there's tons of types of transfers. We're going to talk a little bit today about standing and scooting transfers. So we're going to do stand pivot and those kinds of things. One of our most important things with our transfers is going to be belt placement. So gait belts, people call these gait belts G-A-I-T belts, not gait. Gait is in walking gait. One of the most embarrassing things to do as a clinician is to not know how to put your belt on. And you will notice, if you look at belts, different belts, almost all of them have a very similar buckle. Some of them, if I hold these buckles up in the same position, on this one the tag's on the outside, and this one the tag's on the inside. So I got to be able to lift it up and look and know which way it's going to go on. One of the facilities I work at, every single one of their belts, the tag is on the outside. And in the other facility I work in, all of their tags are on the inside. So I usually have to explain to families, I know it looks silly, but the tag goes on the outside here. If you don't learn anything else from me in 2 years, you're going to learn how to properly put on a gait belt, because it's a pet peeve of mine, and it is one of the biggest safety things that you can do to make yourself safe and your patient safe. So I need someone to come over here for me. Actually, if someone will come stand for me. All right, so Renee's going to volunteer. What I'm looking for is I want to put this belt someplace where it's not going to slide up and down and ride up and down on me. Okay, so Renee's nice and thin. I'm going to touch you, okay?
Okay.
Now, I'm going to go in. On a woman, I'm looking right where her hips are. So she's got this nice hourglass figure, and I'm going to look in just right above her hips and right below her ribs. And that's where I want this belt. Okay? So I'm always going to ask her permission. I've put the belt on a bajillion times. It could be the first time Renee's ever had a belt on. So I tell people, I've got this belt. I'm going to put this on you because it's going to make us both stay safe.
Okay.
All right? If they say no, I have not done therapy before. I'm sorry. If you can't wear the belt, then we can't do therapy. Oh, I want you to put it up high. No, I'm not comfortable with it up high. The only time I don't go here is if they've got like an open wound that's right there that I can't go over. So on this belt, my tag's going to go on the outside, and I'm going to put it around her waist. And I come up between the hinge and the teeth. And the only way to get these on snug enough is to pull straight away from the teeth. So I got it in here where I want it, and I'm going to pull it straight away from the teeth. Okay? And she's going to do that because I want to barely be able to stick my fingers in here. Okay? If I just let go now, what happens?
It slackens again.
I just lost 6 inches of belt that I pulled tight. So I'm going to have to pull, I'm pulling away from the teeth. I'm going to hold this up so those teeth grab in, and then I'm going to flip back through. It's on now. Some people don't like these floopy things hanging here, so they'll tuck them in and stuff, but that's on. Okay, can I get you to turn around?
Mm-hmm.
When I grab a hold of this belt, I want my hand facing the sky. Hand is facing up. Where's the strongest part of my arm? Is my bicep. It's here. It's lifting like this. It's not like this, right? If I try to lift her this way and she goes down, I'm going to impinge my shoulder, and my fingers are going to go open. That has to go through my hand for her to come out of it now. But I can still get my hand out of there and not catch myself. So I don't ever want to be a hold this way, because if she slips, my fingers are the only thing that's holding it, and I'm going to hurt my shoulder. Okay, so I'm taller than Renee, and I've got her by the belt right here. What else is nice about right here is that I've got her at her center of gravity, pretty much. Her center of gravity is about there. If Renee starts to lose her balance, I'm going to feel it long before you see it, right? She was trying to lose her balance there, and I'm not going to let her go anywhere. So if she were way bigger than me, and she starts to lose her balance, that's 10 pounds of pressure pulling her back into position. If I'm standing here and she loses her balance, what do I have to do? I have to lunge and try to catch her. Now I'm going to hurt myself. So there's no point in having it on if you're not going to hold on to it. So I might just be contact guard. I might just have a hold of it. I might have to actually move her around with it.
I have a question about that.
Yes, ma'am.
I was confused on that in the lecture. Contact guard is where you're just holding, but you're not actually
I'm
applying.
touching but not assisting.
Okay, so from here, it may just be like your finger is just
I
moving
still
through.
have the whole belt,
Okay,
but I'm not doing anything to prevent her from moving any direction.
okay.
So she can move anywhere she wants. Go ahead and move. I'm not helping. I'm not assisting. I'm not preventing. Now she starts to fall over.
The minute you,
Now she's not contact guard anymore.
right, okay. Okay,
Okay.
I just wanted to clarify, because I was like, I re-listened to like 3 times.
Okay, so contact guard, as soon as I actually do anything, I might just not be quite ready to let go, because when she does go, it's usually like this. And so if I let go, I'm not going to be able to recover. Sometimes it's just how confident you are as a clinician, or what's your size difference, or how, do you have cat-like reflexes or not. I'm a little slow, so I don't like to get too far away, because then I'm like, oh, processing, oh, they already hit the ground, and I haven't processed it all yet. Okay, so this is the very best place for me to have her. A lot of times, and anybody that's worked in a nursing home, you'll see people that want to put them way up high. So they'll put them up here, because grandma doesn't want you to hurt her chest, or she's really short, or, I'm sorry. Okay, so I'm still how much taller am I than she is?
6.
Okay, now where's my, what position is my shoulder in now? Okay, I mean, do I have any safety lead to come up here? And grab that belt the way you're supposed to have it.
Oh, ow.
Okay, so now Renee starts to go down. What's gonna happen to poor Leah? Okay, she's really gonna hurt herself. She is not gonna be able to get that. I get this down
And
here where it belongs.
I didn't fake that.
I get this down here where it belongs. Now, Leah, stay here.
Oh, sorry.
Okay, so she's in a much more comfortable, and Renee's taller than Leah, just a smidge. She's got much better control of her, right?
Yes, because I was
Okay.
falling with her.
And so I want to keep her in nice and close where that, so now she's going, and now I've really got that power.
Yeah.
Because you're in and you're close, and your biceps in its strongest position. Look at that gun, baby.
I was gonna say, we would not be the best.
Oh, get back here. That'd be
We
good.
could probably do that.
Somebody
without
called a
the belt
vet.
on.
Yeah, somebody called a vet, because those pythons are sick. All right, have a seat here. Now, watch this little trick. Scoot back a little bit. So, I would much prefer to put this on her in a flat position, which is usually supine. Okay, I would much prefer to put her belt on supine. I'm going to stick it under there just like I stuck a chuck under her. Because little skinny Renee, one of the skinniest people in this class, I put it on tight. She stands up. Go ahead and stand up. What's just happened to it? Okay, now I'm going to give poor Renee a mastectomy if she loses her balance. Look how much we gained in little skinny Renee by putting it on sitting. So if I have to put it on sitting, once I get stood up, I frequently have to readjust to keep it. I mean, did you see how much more I yanked out of it in standing? And she wasn't like pushing her stomach. She didn't have any stomach to push out. So if it's happening to her, just think what's going to happen when you put it on someone like me or someone that's really big. Someone that has a belly like this and it goes on here, it's just going to roll right over here and up, and then all of a sudden you're giving grandma a mastectomy, or you're hurting your shoulder or whatever. Now go ahead and sit. Some of your female patients are going to have big chests, and some of them, especially in the hospital, they're not going to get to wear their support system. So, and the older you get, the more gravity effects, they start getting down here. I want them out of the way. I want to get my belt under the girls. Okay? I don't want to come across in a loose fitting gown. I have absolutely no idea where they are. They could be way up here. They could be literally on your lap. And so I usually, as a male, I'm usually like, okay, Ms. Valentine, I really need to put the belt right down here, so we'll get here. Now I'm going to pull it right across here. Do we need to get anything out of the way? She'll grab them. Lift them up out of the way. I'll put my belt on. Same thing goes for a stomach. If I have a great big old belly, where do I want that belt? I want that belt underneath that belly, because if I get it snug under that belly, it is not sliding, okay? It is not news to big people that they're big. So if you're a professional, you're not going to offend anyone. You say, you know, it would be, I really need to put this under your stomach. And then I just very gently pick up their stomach a little bit, slide my belt under it.
That was the other reason you probably want them laying down when you put it on, because
It's even
all,
easier to
yeah.
get on because the girls are here in their armpits instead of down here on their
And our
lap.
stomach is-
And the men's stomach is up here instead of
Right.
resting on their lap. Okay, so that's an excellent point, is I would always prefer, sometimes I just don't have, the tech brought them to me in the gym and they're sitting in the wheelchair, I don't have a choice. If they got a pannus, have we used that word? Pannus?
Yeah.
Is that when the skin actually starts to fold over itself, it becomes a pannus. If you just have a beer belly, that's not a pannus. If it's just sticking out here and you got like a basketball under your shirt, that's just a big stomach. If it actually starts to fold over itself, it becomes a pannus. So if your patient has, I've literally had patients with their pannus that has gone below their knees. And so we have to get I have a coworker that actually made a sling on a walker to set the person's pannus on so they can carry it around on the walker. So I would like to get it under their pannus. I'll lift their pannus up and stick it under. If I make eye contact and I don't make faces like, oh, this is the grossest thing I've ever done, I honestly don't believe I've offended people at work. Don't get me wrong, but it's not for this reason. So, you know, if I'm professional and say, you know, I really need to get this underneath your stomach, it's not news to these people they're big, as long as I don't give them a 10-minute lecture on weight loss or how I'm afraid I'm going to hurt my back because you're so big. I don't think I offend people. All right, so Steve, come up here.